Hello, I'm Dr. Joyce Bassett and I'm a dentist out of Scottsdale, Arizona. How do you feel when you look at your schedule and you see a re-cement crown? You walk into the operatory, you look at the tooth, and it's a lot of dent exposure. And some of them, they're kind of short to preps. So what am I thinking? I'm thinking dual link adhesive resin cement because a bonded restoration is a stronger restoration. So I'm thinking about bonding. The shear bond strength to dentin is really high with the cement. So it's gonna stick on and it's gonna stay. Now I have to use this with a bonding agent. So I'm gonna use All-Bond Universal. All-Bond Universal has this MDP molecule in it and it chemically bonds and it's a coupling agent. One end of it is going to be connected to the resin cement and the other end is going to be to the tooth. When you cure it, the film thickness is only 8 to 10 microns. So now I have to look at my crown and decide, what do I have in my hand? If it's a glass ceramic crown and it came from the laboratory, then usually they hydrofluoric etch it and they've already silinated it. If it didn't come straight from the laboratory and they just debonded it, then I have to do hydrofluoric etch and then clean it and then silinate it before I place it in the mouth. Once I try it in, either way, whichever way it is, it's gonna get dirty and I have to use phosphoric etch on top of it and let it sit and then rinse it before I cement it into the mouth. Now, if it's a zirconia crown, which is an oxide-based ceramic, then we have to clean it with Zirclean because once you try it in the mouth, the salivas, they stick to it and they don't come off. And you can't use phosphoric etch, you have to use Zirclean. And Zirclean will clean that off. And then you want to bond that crown on, you have to use Z-Prime, which has that MDP molecule in it, which is a really good coupling agent. Now, those crowns are ready to be cemented into the mouth. Now, I have to look at the tooth. And if I see an enamel ring around the tooth, then I'm going to use the selective etch technique because I want to bond to that enamel. So I'm going to use selective etch and then rinse that off. Then I'm going to place my dual link cement inside of the crown, which I love the texture and the flowability of the cement. It's just the right amount. It's not too thick, it's not too runny, and when you put it there, it stays there. Then I'm going to take that and put it over the top of the crown. And you can tack cure it for 2 to 3 seconds and peel it right off. And then some people don't like to tack cure and they'll just leave it on the crown over the top of the tooth and then they will clean off the cement and have 3 minutes before it will get hard. Once I take a radiograph, then I can see the cement because it's very radio opaque. So if I have any remnants of cement, I can clean them off and then do a final cure. If you don't do a final cure, it doesn't really matter because this material is dual cure and it's going to cure whether you put the light on it or not. So it's up to you how you want to cure. The next time you have to re-cement a crown, look at the prep. See how much dentin is exposed. Think about bonding because a bonded restoration is a stronger restoration and it's going to have a higher probability of never coming off of that tooth. Think about All-Bond Universal as your bonding agent because of the MDP. Think about dual link because it has dual cure capabilities and high shear bond strengths. And I think you're going to have predictability and less complications and inconveniences in your schedule if you start bonding your posterior EMEX and zirconia restorations. Thank you so much.